Hi, I'm Adriana here with Meridian Health Institute. I'm the Director of Patient Care here along with...
Hi, I'm Natalie. I'm Director of Clinical Care here at Meridian Health Institute in Sugar Land, Texas. What are we going to talk about today?
Today we're talking about, I have some questions, Nat, that patients have been calling to ask questions about what the difference is between flu and COVID.
Oh, yeah. Okay. So they're very similar, actually. So with the flu, typically the flu.
Yes.
Fever, body aches, no
Yes.
appetite, fatigue. You can get all of those same symptoms with COVID very easily. Headache, sore throat, body aches, fever, no appetite, no taste, no smell, and really, really, really tired. And so it mimics.
So what should we do when we have, when we don't know, right?
I mean, the best thing to do is to get PCR tested. PCR tested for COVID, it's more sensitive than the rapid, and it takes about 24 hours to get it back. But we do want you to call us first so we can go over the symptoms with you, because there are some patients that we want them to test for both flu and COVID.
I got you. So you can test for both.
Sure. And we have had a handful of patients that have had both at the same time.
Wow.
Yeah.
So what about allergies versus COVID?
So this year, we're finding with COVID, it's presenting a little different. Some patients have called with literally just a runny nose, sniffly, runny, watery eyes. Some people yearly suffer from the allergies, which is a histamine reaction to something environmental. And so they, constantly have the runny eyes and the nose and the sneezing and itchy and that type of thing. If that goes away with your regular antihistamines, and you feel completely fine, it's probably your allergies. But a lot of patients that have been COVID positive have simply had an itchy, runny nose.
Wow. So what about if I have the taste and the smell, but I don't feel well?
So this year's been different as well with that. Last year with COVID, or I'd say the last 18 months, taste and smell, nobody had it. It went away for almost every patient, and some patients 6 to 8 months to get it back. This year, some patients don't even have fever. Some patients don't even have a cough. And I've only come across maybe 10 that have actually lost their taste and smell. So it's very different.
So what about the age differences? Have you noticed that there's been a change for ages, like a group of ages? Because I feel like we have also entered into this realm of, we have children that have tested positive for COVID.
So depending on the child's age, usually about 16 and under, we'll refer back to their pediatrician. And, we can give a lot of guidance and whatnot for that. So if any of our current patients, call about symptoms and they have questions about children within their household, then we're happy to help with that.
Oh, awesome.
Yeah.
Awesome. So what is RSV versus COVID?
So RSV used to be mostly a childhood respiratory illness, premature babies. Used to be a Synagis vaccine actually for premature babies. And you didn't hear about it for a long, long time. And now it's reared its ugly head. So children are now where they weren't before, when it used to be an over 65 more of an illness with COVID. Now it's going all the way down to infants. So I always shared, don't assume, get tested.
Absolutely.
And the rapid tests are running, they're not as sensitive as the one that goes to the lab. So I always recommend, if you got a negative with the rapid, get a PCR, because it's so much more sensitive.
Yeah.
And a lot of the pediatric urgent cares will test for both for your child. They'll test for RSV, flu, and COVID.
Wow. So what if I have a friend who happens to go to my church and they're having the same kind of symptoms, or they think they have COVID? So what should we do with those patients?
Well, one, if they don't have a provider, they are welcome to call us. We can get them out paperwork, and with COVID, we're doing everything by telemedicine.
Yes.
If we still feel that they need a chest X-ray or something like that, we'll get them to imaging.
That's so great.
But we're always accepting new patients for that type of thing. Just have them give us a call. We'll figure out their insurance. We'll get them taken care of.
Awesome.
Yeah.
Awesome. So they can just give our our office a call.
Yep, just call the regular phone number, the 281-265-6565, and any of us can help them.
Awesome.
Yeah.